Hi, everyone. And Jenny, I don't see the slideshow format yet, so it might be sharing a different screen. Yeah, there you go. Uh, let's see, let's get that up.
Can you see it now?
Nope, now it's not sharing anything.
Cool. Okay, 1 second.
Yeah, sometimes yep, I think and then F5 or slideshow.
You're still not seeing it?
We're not. I'm going to introduce you and then I'm going to run back to your office. So, hi, everyone. Welcome to Georgia MemoryNet or GM Insights. I'm your guest moderator today in place of Dr. Johnson, a poor substitute, I realize, but we have a phenomenal speaker this week. So today we have Jenny Gay, who is the licensed clinical social worker here at Integrated Memory Care, which is where we are both coming from. You might see us both on camera soon. And Jenny's going to talk with us about care partners. Her role here is primarily, she is our main point of contact, definitely spends the most time with our family care partners and caregivers of our people who are living with dementia. And so, oh, you are getting so close. Display settings, and yep, try that. There it is. I'll pass it over to Jenny.
Sorry. Thank you so much for having me. I really appreciate all of the work that all of you do in our community and supporting people living with this disease process and their care partners. So thanks for having me today. Um, my presentation is how care partners can access resources, education, opportunities to implement self-care. So I hope at the end of the presentation, you feel like you have some more mechanisms, more information, and ideas on how to support care partners as you navigate care for your loved ones. I want to make everybody aware that I do not have any relevant financial conflicts with presenting this information and participating in this today. And we're going to get started. So, this is a little bit outside the box. Um, and the hokey name that I come up with for this exercise is just care partners are superhuman exercise. Um, so if I could ask all of you to please close your eyes and take a deep breath, because I know you're all in the middle of your workday and just want to ask you to focus with me for just a moment. Um, I'm going to read some information to you. It is relevant to the caregiver or care partners that I serve here in clinic in one-on-one sessions and throughout the week in various ways. These are some pieces of information and statements I've collected from them just to put you in the perspective of being a care partner. So, medication, meals, dressing, bathing, holiday, transportation, wheelchairs, walkers, oxygen, diapers, wipes, engagement, companionship, safety, supervision, appointments, work-life balance, strain on relationships within your family system, ER visits, short-term rehab, assisted living, memory care, wounds, home health services, palliative care, financial stress, your own personal health problems as a care partner, maintaining dignity for your loved one, wandering, and guilt whenever you are away from your loved one. These are the stressors and concerns shared with me during sessions with family care partners clinic over the last 2 weeks. These are only a small portion of the stressors and pressures that family care partners are experiencing day in and day out as they care for their loved ones. Care partners are superhuman, truly. And I also think they're superheroes. I hope the information I share with you today will help you to support the care partners you encounter in your work every day. Thank y'all for doing that with me. I'm going to keep rolling. So something that I have also been talking to care partners about when I am meeting with them and supporting them in my role here at the Integrated Memory Care Clinic, where I'm the clinical social worker. These are the things that I think make a really big difference and lay a foundation and create a rapport that allows a care partner to really engage with you in order to really benefit from the resources you have to share with them. Because like any relationship, trust has to be built, and rapport has to be developed. So these are the three things that I think were the biggest things when I talk to care partners about this. Providing validation for a care partner, it can make a huge difference in someone's day for you to acknowledge that their loved one looks good, they smell good. That acknowledges that you're tending to their incontinence if that's an issue they're facing. You've done their laundry. You've made sure their skin is okay. You've made sure they got their medicine and that they're able to be at this appointment and present well. Acknowledging those small things makes a huge difference for these people that are so often so isolated and don't receive that validation. It's powerful. Listen to the care partner while honoring and supporting the dignity of the patient throughout any interaction. So often in appointments, and something that I think is so special about our clinic is that many providers, once someone has a diagnosis of any type of dementia, starts automatically just communicating directly with the care partner versus the patient. It's important to provide that dignity and acknowledge that the patient is there as well and that they need that interaction and connection with you as well. Sharing of resources, education, and information that can enhance safety, quality of life, and ease the care partner burden in any way possible. I know it is hard to share resources when you are in a time crunch and you have a tight patient panel, but these resources can be life-saving, life-changing, and are really impactful and meaningful to the care partners. So I'm going to talk about two primary community resources because my understanding of this group is that it is folks from all over Georgia who are providing primary care and probably interfacing with a lot of people navigating dementia. So when we talk about generalized resources across the state, two things stand out to me. And I know that you all probably have an awareness of them, but how to access them and how to communicate with patients about them and their care partners can sometimes be challenging. So the primary resource that's going to administer Medicaid waiver programs, help connect people with respite grants, help evaluate people for any benefit they may be eligible for that they may be missing, is likely going to be our area agencies on aging. There are 12 in the state of Georgia. Our primary one here for our 10 county metro area in Atlanta is called Empower Line. And that is the process in which, especially our patients from clinic, are able to apply for Medicaid waivers to pay for home care services, adult daycare services, and personal care home placement. Many people are also able to access Meals on Wheels through these programs, find out about respite grants, and also sometimes there are various forms of financial assistance. And so this is a really good way to access those. I've provided a link in my slide that has a list of all 12 of the area agencies on aging in the state. And when you click on that link, you will see the listing of them and how to contact them. I think it's important as a provider to know the contact information for the area agency on aging where you are practicing medicine if you are providing care to older adults. The next group is the Alzheimer's Association, which I know you all have an awareness of as well. I think the wealth of knowledge and resources that come from the Alzheimer's Association are grossly underutilized in our community and our country. The amount of education that a caregiver care partner can engage with. I'm sorry, I use the terms caregiver and care partner interchangeably, so just give me some grace on that, please. So, myself as a professional, I have gone through so many of the different classes that the Alzheimer's Association has put together to educate people about different types of dementia, about how to navigate different problems like incontinence. Another big one is how to tackle wandering, how to make a home safe for somebody living with dementia. These are really practical pieces of information that people need in order to support their loved ones living at home. In addition, it also is a portal and a place where people can find support groups that happen in person, support groups that happen virtually. There are also a lot of programs for people moving through the early stages of this disease process. There's a group here in Atlanta of early stage folks that go and have meals together once a month. There's another one that has a music group that happens. It's a really good way for people living with this disease process and their care partners to come together with others, gain knowledge, share resources, and be together. So I there's not much you can't find on the website for the Alzheimer's Association. This is the general link for the whole state of Georgia. Um, but of course, there are some subcategories throughout, and it's divided up, and there are some specific contacts for each region. But this is a really good place to start. If you find that you are in need of locating that specific person that does outreach in a different region, please feel free to reach out to me. I can find that person for you. I want to talk briefly about different kinds of respite that support a care partner, placement options, and additional care. I spend a lot of my day providing education to families and care partners about how to access different resources, how to pay for different resources, and how to move about placement process when that's necessary. So it's important for care partners to know that these services exist, that these types of care exist. I think it's a very common misconception in our society that it's either living at home or going to a nursing home. There's a huge world in between that. And it's important that people know how to pay for it, how to access it, and what those options are. So I'm just going to quickly go through this list. All of these could be a presentation in and of themselves. So I'm just going to try to be concise and just provide the info I think that's most important. Adult day programming. Adult day programming is a fantastic, cost-effective solution for people to get engagement, share meals with people. Adult day programming can be health-oriented or social-oriented, or it can be both. A Medicaid waiver can pay for adult day programming, long-term care insurance, out-of-pocket costs, and VA benefits can also offset the cost. So we have a listing here with all the cognitive neurology social workers, myself at IMC, and we update it a lot to make sure that it is relevant to each county, making sure people know it to access, and I share it with my caregivers. This is a good way for someone to remain at home, for their caregiver to have a break, for them to go engage in programming, come at home at the end of the day. Some adult day programmings can also provide skilled therapies on site. They can provide bathing on site. They can provide wound care on site. So it can really be a hub of care for a care partner for their loved one. Home care services are another huge tool for people that want to remain at home or may need additional care in a care setting. Home care services are typically going to be provided by an informal care worker who may be a certified nursing assistant, not with an agency, and then we have agency-based caregivers. The ways to pay for home care are out-of-pocket, long-term care insurance, VA benefits, and Medicaid waiver. So it's important to make sure that if people are planning to keep their loved one at home, they understand what these costs look like and how to access them if they don't have the resources to pay for them without a Medicaid waiver. Short-term respite stays in a living environment. This is something I think that doesn't happen as much as it used to, but a lot of assisted living communities and memory care communities and some personal care homes, sometimes nursing homes, will have the availability or vacancy within their environment to provide a 2-week to 30-day stay for someone. Say someone is, the care partner is traveling, needs to be out of the country. Again, this I don't see this happen as much as I used to, but it's something that I do see happen sometimes. And I know some folks that can connect people to identify what communities are offering this. A short-term respite stay like this is typically paid for through out-of-pocket expenses, but sometimes there are ways to utilize other resources, and sometimes a Medicaid waiver can cover it as well. Long-term placement in a community environment, once somebody is not able to stay at home safely anymore, there's a million reasons why care outside the home makes sense for people and why it doesn't make sense for other people. But knowing that there are personal care homes, which tend to be home-like environments that have, there's some personal care homes that are very small and have 4 to 6 residents. There's some personal care homes that have 20 to 30 residents. Some of them have security features. So if someone is a wandering or elopement risk, they're in a secure environment, but most of them do not. Personal care homes accept Medicaid waivers. Some of them accept Medicaid waivers. They accept private pay, VA benefits, um, and then long-term care insurance can also pay for them. So personal care home placements for people utilizing Medicaid waivers is the only placement option utilizing a waiver um, for not transitioning to a nursing home. So if someone's not safe at home and they have a Medicaid waiver, that's their option for care outside the home, except for a nursing home. Assisted living and memory care, um, the definitions for these things can be very intensive, but assisted living is a form of care that was designed to assist people with their activities of daily living, to also provide meals, engagement, medication management, a lot of care. It's typically tiered, it's private pay, long term care insurance, and VA benefits can help, but assisted living does not accept Medicaid waivers. Memory care is all of the care that's provided in a personal care home or assisted living, but it's in a secure environment. So there's a keypad to access in and out people who have wandering or elopement risk. This is typically the most ideal situation for them so that they're not able to leave the premises without supervision. So memory care can be paid for with long-term care insurance, private pay, or VA benefits. Skilled nursing facilities, also interchangeable with nursing homes, are for folks who have a skilled nursing need or who, I think people end up in skilled nursing facilities because they have a skilled nursing need or they have a financial circumstance that is the only place they can receive care and afford to receive that level of care. Many of our patients never set foot in a nursing home. It's not an inevitable situation. So making sure people understand all of the different options and care in between. Additional care and end of life care that I think is sometimes underutilized, that I think we do a great job of implementing here in our practice to make sure people use these services when they can, are home health services, palliative care services, hospice services. Home health care is typically going to be tied to a medical event, requires a doctor's order, is coming from a hospital or coming from a primary care physician to implement skilled therapies in the home, like physical therapy, speech therapy, occupational therapy. Palliative care services can be outpatient based or it can be community based. And we have some great providers here in the metro area, and I know in more rural areas that can provide palliative care in a person's setting. So that, provides a nurse practitioner going out once a month, evaluating symptoms, hopefully connecting with the other medical providers that are treating that patient and trying to hone in on how to treat those symptoms in the environment where the person is living in order to help them have the best quality of life. And then, of course, hospice care is something that can be provided in the home or in any of these settings. It is something that can really support people and help people. So I think education about all of these different systems and environments is lacking. And I certainly don't expect any of you to be placement specialists or know all of this information by heart. I'm going pretty quickly because my time is limited, but I do think it's important to help families connect with resources that can help them access these different levels of care, because certainly as a primary care provider, it's tough to have the time to do all of it. So the professionals that can connect people with those resources and can provide hands-on support to people are these professionals. I will say the majority of these disciplines and professions do require out-of-pocket cost, which is unfortunate, and I wish there were resources that were available to everybody, but do tend to have an out-of-pocket cost. But it's a resource you can refer people to. And so you can click on any of these links and learn more about these disciplines, professions, the services they provide. We've got geriatric care managers. That's the kind of work I did before I had the pleasure of joining this wonderful team. There are senior movers and transition specialists, elder law attorneys, daily money managers, veteran service officers. I have found recently have been extremely helpful for our patients who are veterans that need to access aid and attendance, which can pay for home care services or adult daycare services or offset the cost of living in a senior living community. These are people that can tell people what benefits they're eligible for, how to apply, what paperwork they need. VA benefits are pretty complicated, so these people are very special. There's not a national organization for this service, but local senior placement specialists. So these are folks that are experts on personal care homes, assisted living, and memory care in their communities. They can help to negotiate rates. They can advocate for people. I encourage you to try to find people that provide these type of services that are locally based, not national large chains, because the local people probably have more of a pulse on what's happening in these places. They probably set foot in these places, and they can actually take you on tours and help with the negotiation of rates as well. I wanted to give you some ideas. I think often when care partners need to implement self care, a lot of them don't know how to do that. Some of these ideas may seem really hokey, but they were just some of the main ones I think about that caregivers share with me often. So, support groups, individual counseling, exercise in any form, sleeping, meditation, music, cooking, tai chi, being outdoors, art, if something gives somebody peace of mind, it takes them away from the busyness of what I shared with you at the beginning of the presentation. For me, that's a win and that's self care. But I am someone who really struggles with implementing self care. So I know that it can be really tough. But I think encouraging people to carve out the time and knowing what serves them in that way is important. Care partners can benefit from encouragement and permission from as many people as possible to prioritize their mental, emotional, physical, and spiritual well being. Guilt, fear, and anxiety are feelings caregivers often share when they think about planning time for self care. These guilt, fear, and anxiety, I think, are some of the biggest obstacles I see in front of caregivers when they want and need self care. Finding someone that you trust with your loved one so that you can really engage in self care is another big challenge. But I think hearing from a medical provider that's guiding care for a loved one for you to encourage people has a really big impact. It has a bigger impact than you can imagine. I think it's equally as important as validating the good care you see someone providing for a loved one. I wanted to provide also a reading list. I don't have much time to read these days, but I have read all of these materials and books, and they have all offered me a lot of wonderful things. The top two are probably my favorites, and I integrate what I've taken from them into the work that I've done for years. I read these books many years ago and I've read them again. I think these are just a good resource to share with care partners who are coming in and need something to connect with. So I tried to move quickly because I knew my time was limited. So I apologize. I'm a talker, but I wanted to get through as much as possible. And again, it's been such a pleasure to be with y'all. Thank you for giving me the opportunity. I believe this is the last slide, the end of session survey. So you will want to do this in order to get credit for coming to this lecture today. And I think you can scan the QR code. And I'm going to turn it over to Lori Beth, I think.
I was just looking at the chat. So for folks, if there are questions, we do have a few minutes for that. Also, my applause for Jenny, my virtual applause there. Thank you so much. I don't have a question waiting from the group, so I'm going to get to ask my question, which is, when people come to you, you have all of this kind of vast knowledge. Do you sort of have like your most immediate or critical things that you're like, okay, like, these are the top like one or two things I absolutely have to address for this person to get them to the right place?
Yes. So I've started doing individual psychotherapy sessions with our family caregivers, which give me kind of the best opportunity to really assess what their needs are. So in those sessions, I think my top priorities that I want to tackle are, what do your financial resources look like? And what are your goals of care and for living through the rest of your life? Do you really want to be at home? Do you want to move to a community? What do your resources look like? How can I help you be realistic about those expectations? Safety is the other thing I always want to tackle. I ask about firearms in the home. I ask about wandering. I ask about, have you implemented the safe return program or some type of tracking on your loved one? What type of supervision do they have? Are things in the home secure in a way that's safe for them? And then I always try to touch on how the care partner is doing, how their physical health is, how they're managing these responsibilities and also caring for themselves, which also ties into checking in on legal arrangements to make sure that people have financial power of attorney, medical power of attorney, a will. Um, we talk with a lot of our families about the pulse form and making sure that's completed and scanned into their chart. We also like the healthcare advance directive scanned into the chart. So I would say those four things are what I'm trying to hit initially. And then from there, conversations kind of grow, but I always try to hit that information from the get go.
Thank you, Jenny. In case anyone had a question of why you've been such a critical part of our team, I think that just demonstrated it. So the question in the chat then is, do you refer folks in the Metro Atlanta area to Empower Line when they need home modifications for safety and independence to age in place? That's our, go ahead.
I do. So sometimes, depending on who returns the call, when they're doing screening, sometimes I typically have to encourage caregivers to ask for anything outside of just the basic waiver program. There are a couple of other non-for-profit organizations area in the metro area that do have grants for home modifications, really in partnership with the AAA. But certainly, yes, and I probably could do a better job of that. I also know that our veteran patients as well have some access to home modification as well.
Thanks, Jenny. I'm going to turn it back to Lori Beth. Anything we need to do to wrap up? I know we're at our time.
Yep, if there's not any last minute questions, that's it for today. Thank you, Jenny, for joining us. Very important and helpful information. Please feel free to fill out the evaluation survey, even if you don't plan on obtaining the CME credits, because we'd like to hear from you. Otherwise, I hope everyone has a wonderful afternoon, and we'll see you next month on our next GM Insights with Dr. Johnson. Thank you.
Bye-bye. Thanks again.